questions. If we have time, we'll take more. First question, please. Question: is it possible to harvest and bank one's egg because one is close to menopause? Menses have become irregular and flow scanty. The question is it possible to harvest and bank one's egg because one is close to menopause? Well, this question has two parts. Is it possible? Yes, it is possible to harvest and bank eggs, female eggs. But we don't bank female eggs when you are close to menopause. All right? Because when you are close to menopause, the eggs you have, see, a woman has the complement of eggs you need in your lifetime has been deposited inside you, inside the ovaries by God, and you don't have the ability to make one single egg. By the time a woman attains puberty, the woman has about between 400 and 500,000 eggs. And this is what you use every time. Every time you do your cycles, you use them up. And so by the time it does appear that you use the best first. So what I'm trying to say is that the one you use last month are more likely to be better than the ones you will use next month. Which means that when you are young, you have better eggs with better quality. All right? So when you are old, you are likely to have older eggs. And these eggs that are left behind around menopause are likely to be the ones that are likely abnormal. There's a condition called aneuploidy. And this is one of the reasons why older women normally give birth to children that are that have congenital anomalies. So it is not advisable to bank your eggs because you are close to menopause. That is a wrong reason to preserve your eggs. But yes, if you have to preserve your eggs, maybe because you are going for surgery, or even if you are a career woman, you don't want to bear children now, but you want to preserve your eggs so that when you are ready, you can go back and use your eggs. It is possible. How can I differentiate? Question now. How can I differentiate between menopause and amenorrhea? Well, I believe this woman is saying, how can I differentiate between menopause and amenorrhea? Yes, first is that I must say that there's premature menopause. You can enter menopause prematurely before the age of 40 years. That is possible. But if you have been having regular menses and suddenly it stops, remember I said regular menses, suddenly it stops and you count the first, second, or third cycle and menstruation is not coming, then it could be taken that this is you have secondary amenorrhea. But by the time, and that means that you are not in your in the period of your life that leads to your menopause. The average age at menopause all over the world is about 51 years, 4 months. All right? So if you are younger, say 40 years, 41, 42, 35 years, and you fail to menstruate, you want to find out whether, by seeing the doctor anyway, whether it is amenorrhea, that is secondary amenorrhea, or you are having premature menopause. But then there are other things that will show whether it is actually amenorrhea or premature menopause. But if you're already in your 50s and your menses is slowing down or coming irregularly and finally stops, then it is, especially if you have not menstruated for the past consecutive year, that is 12 months, then it is safe to assume that you probably have started menopause. So what I am saying is that age is very important The history of your previous menstruation is also very important. What you are you using drugs? Is there any of the things we have said that could cause your menses to stop? Are they there? For example, are you so fat or are you so thin? Are you on drugs? Are you experiencing some hormonal upset and all that? And it's only the doctor that can say exactly what is wrong. So please see the doctor. I want to thank all of us that have taken time to listen. Like I said, the whole essence of doing all this is to provide information in a way that is non-medical. I have tried very hard to break it down. You will notice that I did not use medical jargons and all that, because I want to provide information for women and young girls so that they also can provide information to their friends, their families, and their community. So they are information carriers, and then feminine health can be better. I want to thank you all again for listening, and I hope that you keep safe and during this perilous time of COVID-19 pandemic. I hope to see you next time. God bless you. Stop. Stopped.